Research Analyst in the Department of Human and Organizational Development at Vanderbilt University. That's a mouthful. I'm working with the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. Our presentation today is Perspectives of the U.S. Paralysis Community on COVID-19 Vaccines and Boosters. Claire, take it away.
Thank you so much. So my name is Claire. I use she, her pronouns. And just as a visual description, I am a white woman with blonde hair, and I'm wearing a orange and white striped shirt today. So like Sarah said, I work with the Christopher and Dana Reeve Foundation as one of their external evaluators in my role at Vanderbilt. And so we do a lot of research with them alongside evaluating the National Paralysis Resource Center about topics of interest among the paralysis community. And so this is an effort that we conducted with the Reeve Foundation during the initial rollout of COVID-19 vaccines, and then a follow-up study about their perspectives of people with paralysis on the boosters as well. So yeah, our goal was just to explore the perspectives of the paralysis community on COVID-19 vaccines and boosters. And so when we say paralysis community, we don't just mean people with paralysis, we mean everybody in their lives. So family members, caregivers, friends, healthcare professionals. And then also when we say paralysis, the Reeve Foundation defines paralysis really broadly. They don't just include spinal cord injuries. It's also things like MS, other like non-traumatic and traumatic spinal cord issues, all kinds of things, hemiplegia, stroke, cerebral palsy. So we have a wide definition of paralysis that was used. And so there's a lack of research on vaccine hesitancy, specifically in this community. And I'll kind of get into that a little bit in what we found in some of the open-ended results. So we conducted two efforts, like I said. So the first was about their perspectives about COVID-19 vaccines. That was in February 2021. So in the very beginnings of the vaccine rollout. And then the booster effort was conducted at the end of 2021 into the beginning of 2022. So I think most people had had their vaccines by that point, and the boosters were being rolled out at that point. So that's just a little bit of context for when this data was collected. So we used the Christopher and Dana Reeve Foundation's email list and their social media to contact people in the paralysis community. It was self-report, so we can't, verify all of the responses, but we had multiple choice and open-ended questions that covered demographic information, their beliefs about the vaccine and the boosters, the information that they had received and their concerns about the vaccines and the boosters, and whether or not they plan to receive vaccinations and boosters, or if they had already had at the time that they took the survey. So these are our two, the breakdown for the just general statistics about the two samples. So we had a little bit over 1,000 participants for the vaccine study. Most had paralysis. A little over half were female, overwhelmingly white, 86, almost a little over 86% white, and 49 states were represented. And then the booster study, we had 774 respondents. A little bit more distribution between persons with paralysis and family members and caregivers. 57% were female, again, mostly white, and 49 states were represented. So then we asked specific questions about disability demographics. So if a respondent indicated that they had a paralysis or disability, they were asked a series of questions about their disability. So for the vaccine study, we had 44% of people with paralysis with quadriplegia, 38% with paraplegia, 3% with hemiplegia, 4% were not sure of their type of paralysis, and 11% indicated that they had another form of paralysis that wasn't listed. Most did not use a ventilator. Most did use at least one type of mobility aid, with the most common being a power wheelchair and a manual wheelchair. And most respondents, about 68%, used family and or professional caregiving services. We had similar demographics for the booster study. Half of persons with paralysis had quadriplegia, 41% paraplegia. Again, most did not use a ventilator and used at least one type of mobility aid, and about 2/3 used caregiving services. So we had a good amount of consistency in just the breakdown of the disability demographics for the two studies. So it was good to see most participants agreed that they felt well informed about the vaccines and the boosters. They believed that the vaccines and boosters were safe, and that persons with paralysis should be prioritized in receiving the vaccines and the boosters, which was relevant at the time when vaccines were not available to everybody in the general population. So in the booster study, persons with paralysis were less likely to agree than people without paralysis, that they felt well informed about the boosters, that the boosters were safe, and that state and federal governments were providing transparent information about the boosters. And just to note, when we did comparisons with persons with paralysis and persons without, the persons without paralysis were still involved in the paralysis community in some way. So that's important to note, as it's not just a comparison with the general population. There's still a connection to the paralysis community there, but we still did find these significant differences in how persons with paralysis viewed the boosters. So this was a really important finding for us, and for the Reeve Foundation to know that in both the vaccine and the booster studies, persons with paralysis were more likely than persons without paralysis to have discussed the vaccine or booster with a medical provider. So this first row here shows the first study, the vaccine study. So you can see that 57.9% of persons with paralysis had already discussed the vaccine with the medical provider at the time they took the survey in February 2021. And a little less than half of the persons without paralysis had discussed a vaccine with a medical provider. And in the column that says no, and I do not plan to discuss the vaccine with a medical provider, 21% of persons with paralysis did not plan to discuss the vaccine with a provider, and 31% of persons without paralysis did not plan to discuss it with a provider. And we see similar results for the booster, about a 10% difference between persons with paralysis and persons without, in both the yes category and the no and I do not plan to category. So there was a significant difference between these two groups in how they had been discussing the vaccine and the booster with their medical provider, and if that was something that they were going to do if they hadn't already at the time that they took the survey. And so we had open-ended questions where respondents could write in their concerns about the vaccines if they had, and the boosters if they had any. And so there were some concerns that were shared by members of both groups, and then some that were unique to persons with paralysis. So shared concerns included side effects and the safety of the vaccines, how the vaccine would affect them due to pre-existing conditions, a lack of research or perceived lack of research about the vaccines, concerns about allergies, concerns about childbearing ability after receiving the vaccine, and concerns or hesitancy about what is in the vaccine content. And the concerns expressed only by persons with paralysis were issues with the previous vaccine. Some respondents indicated that they believed that their paralysis had been caused or worsened by a previous vaccine, which made them hesitant about the COVID-19 vaccine. Some PWP were concerned about dying after receiving the vaccine. Vaccine inaccessibility was an important theme about some were unable to make it to a facility to receive a vaccine. Some were concerned about vaccine efficacy, distrust about the vaccine or the government or the pharmaceutical industry, and concerns about the lack of FDA approval due to the shorter timeline. And so there were shared concerns also in the booster study. So distrust came up again, belief that the booster was not needed after you've already received a vaccine, concerns about side effects and pre-existing conditions, again, perceived lack of research, and then again, a fear of dying after receiving the vaccine. So while distrust was a shared concern, it was more often expressed by persons with paralysis than persons without paralysis. And persons with paralysis talked about pre-existing conditions related to their paralysis and neurological health. So although distrust was expressed by both, it's important to note the content of that distrust and why specifically persons with paralysis express more hesitancy and concern about specific pre-existing conditions. So one of the questions we asked was about respondents' current vaccination status. So on the left, there's a column that shows about 15% of PWP, which is the gold bars, and then people without paralysis are the black bars. So about 15% of PWP were vaccinated in February 2021, but about 80% planned to get the vaccine when it was available to them. And then promisingly, in the second study in December 2021 to January 2022, almost 80% of persons with paralysis had received the vaccine by that point. So you can see kind of when the rollout happened for those individuals kind of in between the two survey efforts that we did. Also, about 75% of persons with paralysis had already received the booster. And so there were no significant differences between persons with paralysis and persons without for these first four columns. So if they were fully vaccinated or planned to get the vaccine, if they were fully vaccinated in the second study, or if they had already received a booster in the second study. But this last column on the right, if they planned to get the booster, was a significant difference. So of individuals who had not yet received a booster, they were asked if they planned to receive one. And persons with paralysis were significantly less likely to indicate that they planned to. So a little less than 40% of persons with paralysis plan to get a booster, while 60% of persons without paralysis plan to get a booster. So that was a key finding. And since it wasn't like we didn't tie in all of our, like we didn't ask them specifically why, we asked that in other questions. We can't directly infer why that might be, but the themes of distrust and concern about the vaccine's effects might have a role in that. So that was a finding that definitely warrants more exploration, the specific hesitancies of individuals with paralysis and why they may be hesitant to get that booster, even if they've already received the vaccination. And so we found overall that persons with paralysis and people without paralysis do share some concerns about that vaccine and boosters, but persons with paralysis have some unique concerns and hesitancies that must be understood and by health professionals and in public health efforts. So like I said in the last slide, persons with paralysis were equally, and people without paralysis were equally likely to have been vaccinated and boosted, but among individuals who had not already received a booster, persons with paralysis were significantly less likely to plan to. Persons with paralysis were more likely to discuss the vaccines with a medical provider, highlighting the importance of providers' knowledge about the vaccines and hesitancy in this community. So that's not just physiatrists or other paralysis-specific doctors, but primary care doctors as well need to have an awareness of this for their patients. And so our general findings highlight that there are specific concerns and hesitancies, not just to the disability community, but to the paralysis community, which also might be true for other disability groups. And so having the specificity of exploring it among and understanding the perspectives of individuals with paralysis is an important part of equitable public health efforts. And that's all I had today. I don't know if anybody has any questions that I can try to answer.
Thank you very much, Claire. Appreciate your research and your presentation on the topic. So it doesn't sound like maybe you did this analysis, but in case you did, across communities, not between the two communities, did you find a correlation between talking to a physician and vaccination levels?
That is a good question. I don't think we did, but I can. My issue is it's been a minute since I did this.
No worries. And I don't know is a valid response.
Yeah, and it was hard. It's hard to, because the Re Foundation is not as like they start these research. They kind of start these research efforts as a point of curiosity and a point of how can we best serve our community. And so sometimes the questions are a little bit hard to really get at the specific so they're not written with the goal of statistical analysis in mind, if that makes sense. They are focused on how the foundation can use this information to focus on their advocacy efforts. Does that make sense?
It does. Thank you very much. Another question is, other than lack of, and you may have answered it sort of inadvertently with your last response, but other than lack of existing research, was there a hypothesis or inclination through working with the community that vaccine hesitancy was different in the paralysis community than in the non-paralysis community?
Yeah, I think anecdotally, there's like I said, some people with paralysis, whether this is factual or not, I have no idea, but correlate their own paralysis experience with receiving a vaccine. And so that kind of idea in the community can lead to some hesitancy. And I also think they're tend to more frequently interact with the medical community or like different medical providers. And so it was interesting to see that most people with paralysis had discussed their vaccine with a provider or planned to, because they tend to have that more frequent contact. So it was interesting to I think we were interested to see if either of those two factors of the concerns about new medical developments affecting their paralysis versus having that more frequent contact with a medical provider.
Great, thank you. And then, you started off describing the paralysis community very, very broadly. Were you able to determine any sort of demographic trends or any information on those who were hesitant and why or how they might be or how they obtain their information?
Yeah, we asked a little bit about why, and I think a lot of it came from people with, um, the majority of the people that respond to the survey have a spinal cord injury. So the smaller communities that have other form of paralysis, it's not as robust of a sample. Um, but I think with people with rare conditions, or like conditions that aren't understood very well, we're hesitant about the specific ways, or just concerned of the unknown, because there's no research on how something like the COVID vaccine would impact them specifically, or their people with their condition specifically. Um, so like one person who has transverse myelitis said there's not enough research on it, and my doctor told me to wait until there's more um, anecdotal evidence or research evidence on how it will affect people like me. So it's not, the hesitancy is not only coming from people themselves, but there was just kind of a lack of knowing about the vaccine, and COVID, which I think was a theme for everybody. There was a lot of unknown at that point. So I think that played into some people's hesitancy, and people were getting information from, online and medical providers and family. People wrote about how they had a friend who died right after getting the vaccine, and so now they are telling everybody not to get the vaccine. So I think the fact that it was a very unknown time and we have all of this information coming, it's a really complex issue. So I don't know if that's a very good answer, but
No, I appreciate it. Thank you very much. So we've only got 2 or 3 minutes left. I'm gonna let you close out if you have anything additional you want to say before we finish this session.
I just want to thank everybody, and thank you all for letting me talk about this research. I think it's really important to focus on the paralysis community. These papers are published if anybody's interested, and I also have some work coming out in Including Disability Journal, about people with paralysis experiences with caregiving, which I'm really excited about too. So I feel really lucky to be able to be engaged with the paralysis community. Anthony's question, do you think it's a mix of over-information and misinformation? I think that could definitely play a role. It's just people are inundated with information that they don't feel is complete if they don't think there's been enough research for FDA approval and those kinds of things. And people are hearing all kinds of anecdotal things and research and all that kind of stuff. So I think, yeah, that's definitely a factor. So thank you all.